I want to go through the location, the different types of locations and settings for private practice. And this may seem, very simple in itself, but however, there are decisions that you're going to make along this journey. And some of you have a dream and a goal, but you have to take the baby steps to that, like I did. And I'll just share quickly, now I'm in a 2,000 square foot building we have 8 exam rooms, we have a lab, we have state of the art. It looks great. It's wonderful. However, I had that dream, but a couple years ago, I didn't have the budget to be in the facility I am in now. So I thought about it and I said, okay, so we got to start small. We got to start this thing literally small, and my office is going to be my car. So let's talk about some of the location settings, right? So here I'm going to go through the different types of ways you can provide services, or the different settings in which you can provide services, but I'm also going to give you some pros and cons with them as well. So if you are interested or thinking about doing telemedicine, virtual telehealth, obviously the number one pro is that it's low overhead cost. You're not paying rent, lease, you're not purchasing a building. So the overhead cost is typically low if you are starting or wanting to start a telemedicine or telehealth practice. It also affords you some flexibility, right? So meaning that if you live in Georgia, but you're licensed in Florida, you technically could expand your business into Florida and acquire some patients. Of course, that also depends on the types of services that you would be providing. Okay, so for the most part, you can provide a good amount of essential services via telehealth. Okay, but you are limited in what you can do. You are limited in the way you execute those services. So you can provide urgent care, convenience care, some primary care, counseling, specialty consulting, psych mental health services, health coaching. You can provide all those services via telehealth. You can still offer ancillary services. So you can still send your patients to do lab testing and diagnostic testing. You can accept insurance and cash. And you, as I mentioned, your business can expand across state lines. However, what a lot of people don't think about when starting telehealth is that every state still has its own statutes, its own laws and regulations. So if you live in Georgia and you want to acquire patients in other states you're licensed, maybe Florida, California, New York, that is great. However, Florida, California, New York have their own laws and regulations, and you still have to abide by them, even if you live in Georgia. If you're licensed there, you're providing those telehealth services based on the state in which you're licensed. So with that being said, there may be a cost or there may be a process associated with expanding your business across state lines. You may have to establish a business in those other states, what we call foreign entity. It doesn't mean foreign as in international foreign, but foreign meaning that the business originated in one state, but it is being started or expanded in another. So these are things that, these are some legalities and some nuances that you should know about a telemedicine or virtual practice, right? But nonetheless, it's probably the most affordable and the most convenient and the most simplest way to start your practice. And if you want to expand it from there, you are more than welcome to. Next, brick and mortar or office. Probably most of you have a vision of expanding and starting and growing a business into a physical office location. To be honest, really, there's no limit in what you can do in a physical office. No limit at all. You're able to provide more services and you can increase your revenue potential tremendously. Here's something I've realized every time I changed my business setting. So I started out as a mobile house calls. Then I went in and moved into a tiny one room setup. I had an exam table, I had a desk, I had 2 chairs, I had a cabinet for my supplies. I think it was like 120 square feet. And then I moved into a 2-room office. And then I moved into a 1,400 square foot office. We had 4 exam rooms, we had a lab, we had reception, we had all of that. And then I moved into over 2,000 square feet. Every time I went and moved and increased my office space, I don't know how it happened. I know how it happened, but I don't know why it happens like that. But every time I grew physically, my revenue grew as well. It's almost as if the more money I knew I had to pay was the harder that I went in ensuring that I brought in enough revenue to pay for the overhead costs. So in this journey, you might shy away from getting office space or growing too quickly. But the truth of the matter is, the more you expand and grow, it's like some type of universal law. It's like you start making more money than you did before. Okay, so then some con is obviously increased overhead expenses, but if you're building your business properly, then you will be able to afford those that increased overhead expense. As I mentioned, when it comes to having a physical location, there's really no limit on what services and what you can do within that location. So whether you do specialty, primary care, concierge medicine, urgent care, psych mental health, infusion therapy, med spa, wellness center, or if you want to do it all, you can do it all. And also keep in mind there are ways to acquire space and make it affordable. You don't have to launch your business and get an office space that you can't afford. You can literally start by looking into executive suites that typically in most cities cost you less than $1,000 a month. You can look into now they have like co-shared medical suites. So you can actually rent a medical office room on a daily or weekly or monthly basis. But you are not the sole, person renting that space. So you'll be sharing it. You can sublease an exam room from another medical office. Chiropractors and physical therapy offices are really great about letting and wanting to sublease their rooms to medical type providers. Okay, so there are ways that you can do it so that it's affordable for you. House calls and mobile. This is a way to provide your services that I feel is very innovative, and it's almost for sure successful because people love convenience. People love, if no one, after COVID, if no one had to ever leave the house, they never would, okay, right? I know that you can probably agree. So when you do house calls or mobile, you're offering the convenience. And with convenience comes a price. So you definitely can consider that your services can be priced higher when you offer a home visit or a mobile office visit for your patients. So the pro is that the overhead costs are low because most people that operate a mobile practice, their home becomes like their actual office location as far as where they actually work. so that they're going out to different places, homes, offices, corporations, companies to provide services. The con obviously is that there's constant travel. So almost any service can be mobile. Primary care, urgent care, psych, mental health, specialty services, concierge, infusions, some aesthetic services, depending on what type of aesthetic services you offer, will determine if you can do that mobily, which you absolutely can. And I'll show you guys one of our members of IBAN that does mobile aesthetic services. So just depending, you can get everything you need to provide a service. You can get mobile equipment for it. There are mobile exam tables, there are mobile chairs. So there's really no limit. And you can do nursing services mobile, wound care, post-op care, post-cosmetic surgery care. All of those things can be a mobile service. So again, if you are someone that you are starting this and you are starting on a smaller budget, consider starting mobile. Consider a house calls practice so that you can build yourself up and generate revenue and build clients, and then you can switch over into an office. And now don't shy away or become afraid that, oh, what if I go to an office and my patients don't want to come in? If your patients love you, they're going to follow you. That's number one. Number two, who said that you have to be the one that's still out in the field? If you're going to build a business, the purpose of building a business is to grow the business. So I can only hope that you're not going to be the only one running the business and working in the business forever. So you can have a provider go out and do mobile visits, and you can be the one in the office, or vice versa. Facility-based practice. So this is a location setting that a lot of people don't think about. Only because it's not considered, it's not usually considered as a standalone practice type of business model, but it truly is. Some of you go into facilities or have maybe go into nursing homes and ALFs to see patients. Well, you can actually do that as a business and do nothing else. All of your patients can be in facilities. You don't actually necessarily have to operate an office and have people come to the office. All of your patients are stationed in facilities. So again, the pro is that there's low overhead costs and it does provide flexibility. The con is that because of the type of facilities that there are, most of your revenue is going to be generated through insurance reimbursement. So assisted living facilities, skilled nursing homes, rehab centers, group homes, they typically, the residents that live there that need healthcare services, they typically have health insurance. Now, I do know people that operate cash practices and have patients in these facilities. So nothing is impossible. However, just know that if you do want to acquire entire facilities, if you want to acquire multiple assisted living facilities and go out to these different ALFs and nursing home and rehabs and see your patients, do know that most of them will expect that you accept insurance. So the great other thing is that you have a business advantage over providers who cannot dedicate time to facilities. There are a lot of times in these facilities, especially nursing homes, the residents are under the care of physicians, who the physicians spend most of their time in the office, and they don't really have the time to go out into the facilities and see these patients. So if you were to start a practice and your goal was to acquire nursing homes and ALFs in different facilities, and your pitch or your marketing to them is going to be, hey, I am dedicated to coming to the facility to see the patients. They don't have to go anywhere. You don't have to set up transport. You don't have to try to get the patient or the resident to us. We are coming to them, whether if it's on a schedule, whether you have a provider who will go out interim, whatever the case may be. That is the business advantage you have over other medical groups who cannot dedicate their time to facilities. Right now, I know a nurse practitioner that has nearly, and hear what I said, a nurse practitioner that is managing probably about 1,000 patients across different nursing homes. She is the primary care provider for nearly 1,000 patients across nursing homes in her city. So this is very possible. On-site clinic. Now, if you, whatever type of practice you have, this can be something that you can do in addition to what you are doing, or you could do this as a standalone business. So on-site or near site is the other term. This is a type of setting or a type of setup where you would provide more so convenience care. So when I say convenience care, think of Walgreens and CVS clinics, those clinics that you're not their primary care provider, but yet you're still providing essential services. So someone who maybe can't get to their doctor's office or their provider's office, somebody who's traveling, somebody who's busy, they can't take the time off of work to go in and be seen. So this is those types of healthcare services. So corporate healthcare services, wellness services. You could do IV infusions, urgent care, DOT physicals, administrative exams, drug screening, biometric exams, employee wellness physicals. So you can actually acquire different corporate businesses, companies, and you can go in maybe once a month and say, you know, hey, we're going to come every third Tuesday of the month. We'll be available. And anybody that needs, you know, booster, an infusion, a refill, they're sick, whatever. One thing you have to realize is when it comes into corporate America hates to lose employee time due to needing to attend to healthcare issues. So they want their employees well. So this is not something that's far-fetched. If this is something you're interested in, you can definitely present this to corporations and companies. And trust me, some of you probably have worked for places where someone came in and did or offered screenings or injections or some type of healthcare services. So think about that. If you worked for a company and you were offered that, this is the exact same concept.